Borderline personality disorder, or BPD, is a complex mental health condition that often doesn't exist in isolation. For many individuals grappling with BPD, their journey is further complicated by the presence of co-occurring mental health conditions. This interplay of disorders can create a challenging landscape for both those experiencing these conditions and the mental health professionals tasked with providing effective treatment. One of the most common companions to BPD is depression. The intense emotional fluctuations characteristic of BPD can leave individuals vulnerable to prolonged periods of low mood and hopelessness. It's not uncommon for someone with BPD to experience depressive episodes that are both more frequent and more severe than those without the personality disorder. This combination can be particularly insidious, as the negative thought patterns associated with depression can exacerbate the already fragile self-image typical of BPD. Anxiety, too, often walks hand in hand with BPD. The fear of abandonment and intense emotional reactions that are hallmarks of BPD can manifest as persistent worry and panic. Social anxiety, in particular, may be prevalent. As individuals with BPD navigate the complex interpersonal relationships that are often at the core of their struggles, the hypervigilance that comes with anxiety can amplify the emotional sensitivity inherent in BPD, creating a feedback loop of heightened arousal and distress. Post-traumatic stress disorder, PTSD, is another condition frequently observed alongside BPD. Many individuals with BPD have histories of trauma, and the symptoms of PTSD can intertwine with BPD traits in complex ways. Flashbacks and intrusive thoughts associated with PTSD can trigger intense emotional responses characteristic of BPD. While the difficulty in regulating emotions in BPD can make processing traumatic memories even more challenging, the impulsivity that is often a central feature of BPD can pave the way for substance use disorders. Individuals with BPD may turn to drugs or alcohol as a means of coping with intense emotions or to seek relief from the internal turmoil they experience. This self-medication can quickly spiral into addiction, adding another layer of complexity to their mental health struggles. The temporary escape provided by substances can be particularly alluring to those with BPD, who often seek immediate relief from emotional pain. Eating disorders, particularly bulimia nervosa, may also overlap with BPD traits. The impulsivity and difficulty with emotion regulation seen in BPD can manifest in binge eating behaviors. While the intense fear of abandonment may translate into a desperate pursuit of an idealized body image, the cycle of binging and purging in bulimia can mirror the emotional instability experienced by those with BPD, providing a physical outlet for psychological distress. The presence of these co-occurring conditions significantly complicates the process of diagnosis and treatment planning. Mental health professionals must carefully untangle the web of symptoms to determine which arise from BPD and which are attributable to other disorders. This diagnostic challenge is further compounded by the fact that many symptoms overlap across different conditions. For instance, the mood swings associated with BPD may be mistaken for bipolar disorder, or the hypervigilance of PTSD might be confused with the paranoid ideation sometimes seen in BPD. Moreover, the presence of multiple disorders can mask or exacerbate symptoms of each condition. Depression might dampen the impulsivity typically seen in BPD, while anxiety could heighten emotional reactivity. This interplay of symptoms can lead to misdiagnosis or incomplete treatment if not carefully assessed and addressed. The complexity of co-occurring conditions necessitates an integrated approach to treatment. Mental health professionals must develop comprehensive treatment plans that address both BPD and its comorbidities. This often involves a combination of psychotherapy, medication management, and skills training tailored to the unique needs of each individual. Dialectical behavior therapy, DBT, a treatment modality originally developed for BPD, has shown promise in addressing multiple co-occurring conditions. Its focus on mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness can be beneficial for managing symptoms across various disorders. However, adaptations may be necessary to fully address the specific challenges posed by comorbid conditions. Medication management becomes particularly nuanced when treating BPD with co-occurring disorders. While there is no specific medication for BPD itself, pharmacological interventions can be crucial in managing symptoms of depression, anxiety, or PTSD. However, the potential for substance abuse must be carefully considered when prescribing medications, especially those with addictive potential. For individuals struggling with both BPD and substance use disorders, integrated treatment programs that address both mental health and addiction simultaneously are often most effective. These programs recognize the interconnected nature of these conditions and provide comprehensive care that targets the underlying emotional dysregulation while also addressing the specific challenges of addiction recovery. When eating disorders co-occur with BPD, treatment may need to incorporate specialized nutritional counseling and body image work alongside traditional BPD interventions. The focus on developing healthy coping mechanisms and improving self-image can be beneficial for both conditions, but but careful monitoring is necessary to ensure that progress in one area doesn't come at the expense of the other. The journey of recovery for individuals with BPD and co-occurring conditions is often long and challenging. It requires patience, persistence, and a willingness to engage in multiple forms of treatment. However, with the right support and an integrated approach to care, significant improvements in quality of life are possible. As our understanding of BPD and its comorbidities continues to evolve, so too does our ability to provide effective, tailored treatment. The recognition of the complex interplay between BPD and other mental health conditions has led to more nuanced approaches to diagnosis and intervention. This holistic perspective not only improves outcomes for individuals struggling with these challenging conditions, but also advances our broader understanding of mental health and the intricate ways in which different disorders interact and influence one another. In conclusion, the co-occurrence of other mental health conditions with BPD presents both challenges and opportunities in the field of mental health treatment. By recognizing and addressing these complex interactions, we can provide more comprehensive and effective care to individuals navigating the difficult terrain of multiple mental health challenges. As research continues and treatment modalities evolve, there is hope for increasingly tailored and successful interventions that can help individuals with BPD and co-occurring conditions lead fuller, more stable lives.